Hey everybody, we're going to talk a little bit about clinical experiences and what these are going to look like in the lab. So this is it. This is your opportunity to figure out how to talk to people in the clinic, how you're going to present your treatment. This is something that you'll kind of change and curate over the years as you get better at treatment presentation and explaining things to patients and hopefully getting treatment acceptance. But you also, at this point in time, need to know how to talk to your instructors, how to give them the most information that's going to make your appointment go really well so that your patient is comfortable and you're comfortable and your instructor feels good about working with you and the outcomes of these appointments. You need to have some time practicing writing these progress notes. You want a note that your instructor is going to love and they're not going to want to make a whole lot of changes to. You want to have all the information in there that's going to, protect you as you work with patients so that you have everything needed to be able to explain to someone exactly what happened in the appointment, exactly what your patient said, exactly how things were communicated so that there's not any question about whether or not you did the right thing. To do this, you're going to need to get comfortable with Axiom. So we're going to spend a lot of time doing that. You'll have 6 different projects. The 4th project is going to be pretty extensive, but all of this is going to really hopefully set you up for being able to work with Axiom well and to feel comfortable the first day that you get into the clinic. We're going to be using the procedures in the grading system based on the one that we're going to use to give you your license. It'll be the 8X exam. And so we'll go over a little bit more of that. You've seen it before. We're going to talk about it a whole lot more now. We're going to go over that at the end of this presentation. So the first thing that you're going to do is prepare for your patient. When your patient arrives, you need to review their medical history and their treatment plan and what they're going to be doing that day. So technically you would set up a chair. We're not going to do that here in the sim lab, but you're going to get your instruments ready, get all of your materials from the dispensary or the cart, and you're going to take some time to look at the radiographs. What are you doing today? Check their dates and make sure that they're appropriate, that you don't need to take a new radiograph before today's appointment. And you need to have them up and available so that your instructor can see exactly what you're going to be working on. There's some other, just kind of paperwork things that you need to look at. You need to make sure that their treatment plan is signed by the patient. And then if their patient has arrived, you need to make sure that they've paid for the treatment that's going to be going on today. So once your patient is there and all of those technical things are taken care of, you can greet them, you can walk them to the chair and kind of go over what's going to be going on and take their vitals. So, sometimes patients will arrive early and you might consider, starting the treatment a little bit early. But you always want to check with your instructor before you bring a patient back if it's before their appointment time. So you're going to review and update their medical history, ask them if anything has changed. You don't have to take a full medical history every single time your patient comes in. You'll do that at your OD appointment when you meet your patient for the first time. You'll take their vitals and enter them into a record into Axiom. If they're diabetic, you're going to take their blood sugar and ask them about their recent meals to make sure that they're going to be stable for your appointment. And you're always going to remind them about what you're doing today, let them ask questions about it so that they feel comfortable and they're prepared for the appointment. At this point, I highly recommend that you open up your instruments. Your patient has already been seated and seen that they're clean and they're closed. So go ahead and rip open those packages, set everything up for your instructor, make sure that the Miro and Explorer are available to them. You will win brownie points if you take a paper towel, set it on top of your instruments, and then set the Miro and the Explorer on top of the paper towel. It's beautiful. It's amazing. I love it. I sit down. I don't have to glance around. It's hard with your loops on to look around for things in a small area. So if I can look and find that Miro and Explorer right away, it's so incredibly helpful, and it's probably helpful for you too. So highly recommend. This is a point in time when you're talking with your patient that I can see sometimes students let the time get away from them. You don't want to waste a lot of time here, but you do want to be thorough and make sure that you get everything taken care of, realizing that you need the time during your appointment to actually get some stuff done. At this point, it's time to get your start check. And so I'll go over with you how we're going to do this when you come to lab next time. We're going to set you up with a buddy. You can pick the person next to you. It's probably the easiest thing to do. Initially, one of you is going to act like the student, one's going to act like the patient, and you'll talk and update your medical history. And then you can switch, and one of you will act like the student and one will act like the faculty. And so you'll do a little start check. And at this point, you're going to present your patient to your instructor. I used to use a note card to help me do this. I had a little folder for every patient because generally everybody had a green sheet or a perio sheet or something, and I could have a little note card in there that had their medical history, all of their meds with their method of action on there, so that I was aware of what each medication does. I still find students that tell me about meds and are like, I don't know what that is. You got to look it up. You got to know what you're dealing with when you're working with your patients, because it's on you if something goes wrong and you just happen to not know what one of their medications was. You should have that session's vitals, and you can just kind of keep adding to it. So you have a little list there on your card. Every appointment, you can list their vitals, and then you've got a really great snapshot right there as you're talking with your professor of, is this normal or is this a really crazy one for today that you should be concerned about? So it's nice to just have some way. So I've seen students do this on their treatment plan sheet, on the back of their treatment plan sheet. That's another thing that I would keep in that folder for my patients. So, it's up to you how you want to organize and keep track of things. But I think it's helpful to have a way that is reliable, and you always have the information that you need for your patients. So an example of a start check is something like, so Mr. Garcia is here today for a DO composite on tooth number 19. He's a 60-year-old Hispanic male. His blood pressure today was 145/86 and his heart rate was 78. He's an insulin-dependent diabetic. He takes Novolin before meals. I asked him, he said he has had oatmeal and eggs for breakfast this morning. He takes lisinopril for high blood pressure, and he took both of his medications this morning. So it's a really nice, robust chunk of information that tells me everything that I really need to know. Some patients are going to have nothing. They're going to have no known drug allergies, no medications, no surgeries. They're a healthy patient, and that's great. That's totally fine. But you'll have some that have a crazy long list, and you won't be able to remember all of it. So it will be helpful to have it all written down somewhere. I've noticed a lot of students doing this with screenshots. I think that can get a little tricky as far as HIPAA is concerned. I think that it would be better to have something that you keep at the school that's not on your personal electronic device. That can be a problem, and you can always shred a piece of paper if needed. So anyway, think about that, how you want to start setting up a situation where you have all the information, you're not caught off guard, and you can talk to your professor about your patient. Now, we might ask you questions. We might ask you about a medication, or what does their doctor say about this, or how are you going to anesthetize this patient, or what materials are you going to use? And so just be prepared. It helps to kind of know, especially if you're in a different kind of situation, like if it's a really deep decayed tooth and you've already soaped it, or you have a plan of action for an indirect pulp cap or something like that. So just be prepared. You're going to introduce your instructor to the patient. Let your instructor examine the patient. They're going to look at radiographs. I've noticed that students have stopped getting start check swipes, and I think that that's silly. Just let us swipe your vitals and get that out of the way. We'll swipe your start check to turn it from red to green, and you'll be ready to go. Again, don't hesitate to ask questions about things like general anesthesia from your instructor. I would do this away from the patient if possible. It always helps for them to feel like you know what you're doing, and you're not asking a whole lot of questions that are going to make them worry about whether or not this appointment's going to go well. You'll get different tips from different instructors, different ways we like to do different things. So I think it's always good to ask for tips about things. I think a good rule is to not give more than 2 carpules if you're struggling to give anesthesia, to go ask for help so that we can kind of save the appointment and hopefully get your patient numb without having to just halt things because they've had too much medicine. Again, you need to allow time for the medicine to work, but you don't want to waste a whole lot of time. So if you're struggling, you think something's not going in the right direction, it's always good to ask for help. Rubber dam is required on progress exam and boards, so it's good to practice it. With Isolite, I see a whole lot less rubber dam in the clinic nowadays. So if you have the opportunity and it's a good patient to do it on, I think it's good to practice your rubber dam. It's good to have just a couple of options for clamps set aside. So if you try your first option and it's not working well for you, you can just pop it off and try a different one, and hopefully you'll have a better outcome. You don't want to spend a whole lot of time on this, but you want to be able to accomplish it well for your practicals and your boards. And again, you will have patient progress exams, so you'll have to place rubber dam on a patient for those scenarios. At this point, you're going to complete your treatment. You'll do your ideal preparation. Whether it's in the sim lab or in the clinic, you'll present that as this is my ideal. I still have decay here, and here. This is what I want to do. That's asking for modifications. There's a formal way to do it and kind of an informal way to just talk about it in the clinic with your professor. You'll remove all that decay working with your professor and then present a final preparation that they'll say, okay, let's go ahead and restore. You might talk a little bit about how you're going to do that and go ahead and do the restoration. And then you will take off the rubber dam or take out the Isolite and check occlusion, and then have everything checked for the final restoration. After you finish your treatment, you will be cleared by your instructor to dismiss your patient. I would sit them up and just let them sit for a little bit while you talk and you finish your notes and you get them set up to come back for their next appointment. This gives the blood a chance to come back out of their heads so they won't be a little bit dizzy when they finally stand up. You can go over any post-op instructions for the day's appointment. Talk to them about what they're doing next when they come back. Ask them if they're feeling okay, so that when you say that they were released in good, stable condition in your progress note, that you're telling the truth, that they really are feeling okay, and then you can take them to make their next appointment. After your patient's gone, and as you work with a partner, a lot of times some of this stuff is happening simultaneously, but the treatment will need to be completed in Axiom, and then you'll have a progress note ready for your instructor, and you will call over your instructor to get swipes. And so we'll swipe the treatment is complete. For a operative scenario, when you complete the treatment, a little QA form will pop up, and this will give us an opportunity to make any comments about what went on. I always note if a liner was placed, just so that it's also in that record, and we'll have to say that yes, the preparation was complete, and that yes, the restoration was complete, and swipe that. And so that gives you credit for doing that prep and that restoration. And then we'll read your progress note and swipe it, maybe make any changes necessary, make sure that all the vitals and the med history updates, any ODRA, any updates on any of the other forms are completed. And there's a really kind of nice visual way to see that all the blue is gone. And when all the blue is gone, we'll know that everything's swiped and you're ready to go. I think it's really important as you buddy up together to do these medical history updates and these start checks that you really start thinking about verbiage and the way that you say things. I think you need to start to kind of develop a way that you talk to patients that shows how much you care, that you're not just rushing through things, or you're so technical about things that you're not interested in them and their concerns, and that you really understand what they're talking about. There's a lot of psychology involved in dealing with patients, especially in dentistry when there's a lot of fear. And so I think it's something to really start to think about and while some people are going to do this really naturally, some people might have to kind of practice a little bit. I remember before, like, I would know I had this patient coming in that was really complicated or maybe difficult to talk to, and I would talk to myself as I was getting ready, and just say what I wanted to say to the patient. So I made sure that I wasn't. Sometimes things just get hard. You have to explain situations that are difficult. And so if you can talk that through and make sure you like the way it sounds before you say it to a patient, you're a lot less likely to say something stupid and to find yourself having to explain yourself, or re-explain something, or that's not what I really meant, or, it just helps to have a plan. So think about words that you use, words that are not going to stir a patient up or make them fearful or worried about trusting you and things like that. You really just want to make sure that you're prepared when you go into these conversations. So some of it's going to develop over time. Some of it you can practice with your roommate. You can practice with your friends at school. This is a really great opportunity to do it. You can practice with your dog, whatever it takes. I think it's important to really narrow things down, say what you need to say, and not spend a lot of. I've seen so many students just waste half an hour talking about the procedure, and they probably could have done it in about 10 minutes. So we are going to have our first clinical experience next session. I'll help walk you through a little bit of how we're going to set up the buddies and how we're going to switch it around. I think that your clinical experience form does a really great job of explaining how I want you to do this. So go ahead and read over that before you come in, because I think it'll be really helpful. So this is a lot like those little project forms that you turned in last semester. It's just a Google form that's going to walk you through each step of the appointment like a checklist. So use that as your guide. Look at it first before you ask questions. It should be able to help get you through your appointment. Part of the CE form, though, is an assessment of your final prep dimensions minus any modifications. And so this is maybe a little confusing, but the acceptable criteria is what we're aiming for. We'll look at these numbers here in a second. And so let's say the acceptable criteria is that your isthmus width is 1 millimeter. But let's say you had decay on the facial wall of your isthmus and you were approved for modification to move that facial wall 0.5 millimeter. Now your acceptable criteria is technically 1 plus 0.5. because that was approved for you. And so as long as you have it approved and it still falls within that 1.5 millimeter criteria, it's deemed acceptable, even though it's technically not, and you won't lose points for it. Does that make sense? So if you go beyond that 1 millimeter dimension without approval, you will be penalized. And if you ask to go beyond a dimension and it's not needed, you'll also be penalized. So there's this little game that you have to play when you're looking at decay and prepping these teeth, where you want to try to stay in this little zone of not losing points, but still be able to remove all of the decay to have an appropriate final restoration. So there's 6 major graded categories. 3 of the categories apply to the preparation and decay removal process, and 3 categories apply to the restoration. The 3 different grades that are possible are this acceptable, marginally substandard, and critically deficient. And so you need to try to learn to keep all your preps into this acceptable category and how to avoid losing points for poor decay management. And so this modification process is going to be really important. There's also something called the 3 sub rule. And I'll show you what I mean as we walk through these categories. But basically, if you fall into this marginally substandard category in certain areas 3 times, then it's an automatic failure. So these are areas where if you just start to get really big on preps when it's not necessary, then it's a red flag. That if it happens in these 3 different areas, or it happens in a group of areas 3 different times, then things are out of control and you're not you're not going to pass the exam. There's also some critical failures like fracturing the tooth and some other things that we can talk about later. So the first grading category for the preparation is external form. And so here you can see that we're going to look at the proximal clearance, and this is at the height of contour. So that's facial and lingual, right? The gingival clearance is its own category. You have your outline extension, your isthmus width, your cavo-surface margin, and then sound marginal tooth structure. So here you can see that there's your adheres to criteria or acceptable category, your marginally substandard, and your critically deficient. And so we're aiming for everything in this category. This is what we're hoping you get. Occasionally you may fall into a substandard. Now, if you fall into this substandard category for, a little bit wider isthmus, maybe your cavo-surface margin isn't exactly 90 degrees, you got a little bit of minor unsupported enamel or something like that, it's not as big of a deal as if you start to get really big in these areas. If you really open things up too much and find yourself greater than a millimeter, even though that's less than 2 millimeters, you're going to fall into the shaded substandard category. And if you get 3 of those, that's the 3 sub rule. So look out for these shaded areas in the substandard category, because that can be tricky. It can put you in a difficult position. The next section for the preparation is the internal form. So here you're going to find your axial walls, your pulpal floor, the caries remaining, any retention that you place, which you really don't need to, so it's probably better not to place it on a non-patient, and then your proximal box walls as far as being parallel or convergent or divergent. And so here again, you can see that there's a couple shaded areas here for the 3 sub rule. Occasionally you'll see that there's not a criteria listed. And so like for the caries remaining, either you took the caries out or you didn't. So you either fall into adheres to criteria acceptable or you failed with a critically deficient. And so take note of those areas where it's one or the other. Occasionally here you can see there's not a critically deficient for these areas, and that's basically telling you that it's not that big of a deal to them. To us, it might be a little bit more, but specifically for this ADEX exam, they tend to give you a little bit more leeway in some of these areas. So the final category for the preparation is treatment management, and you'll see this a lot. This is where you see adjacent tooth damage and soft tissue damage. Again, you can see that there's kind of a gradation of how bad it can be, whether it can be polished and doesn't change the contact, whether it will kind of change the contact, or whether it requires a restoration. And here you can see that the soft tissue damage is either you damaged it or you didn't. So now we move on to the restoration. There's, again, 3 categories for the restoration. This is the first one. This is the margin integrity and surface finish. So you'll see there's margin excess or deficiency. So either you've got too much going over the margins or you've got voids on the margin. Adjacent tooth structure. This is not the adjacent tooth. This is the tooth structure that is adjacent to your margins. And so this is an area where if you over polish and damage some tooth structure, you might have some gross enameloplasty that might expose the dentin. And so that's what this means. It's not about the tooth next door. This is about the tooth structure that's adjacent to your margin. Bonding is whether or not the restoration is bonded, or if we find that it's loose. Doesn't seem to be an issue with the decayed teeth, the simulated teeth that you'll be working on. The next category for the restoration is the interproximal contact and the centric or excursive contacts. And so this is where you're going to be checking occlusion, making sure that your proximal contact is visually closed. This is kind of the key here. This is not about popping floss. They don't care. They want to see that there's no daylight coming through your restoration and the adjacent tooth. So that's what you're going to look for. And if you see any daylight, then you're going to have to fix that. And so, again, this treatment management category pops up. This is different. So adjacent tooth damage is actual damage to the adjacent tooth, whether you can remove it with polishing without, altering the contact, or gross damage that's going to require restoration or is inconsistent with the procedure. And then you have the soft tissue damage again. So just a brief introduction, you're going to be asked to assess yourself on all of these categories as you go through your clinical experience form. So start getting, really comfortable with this information and, thinking about the 3-sub rule, thinking about which ones are either or, which ones are, adheres to criteria, acceptable, or fall into that critically deficient category without a marginally substandard. And so this will hopefully, get you used to the idea of catching anything and fixing some things before you lose points in a situation. I think the easiest way to fail these exams is through the modification and decay removal process. And so we'll spend a lot of time talking to you about that and how to strategize a little bit to set yourself up for success. So that's it for the clinical experience. I encourage you to go and look through one of those forms before you come to lab next time so that you're prepared and you know what you're going to be doing. Thanks, everybody.